Good morning, everyone. Thank you for joining us today. My name is Jean Ann Cannon. I'm the director of Dunebrook. We have Lisa Scheller, our development director, and the one and only Ann Rissmann. We are so happy to have Ann with us this morning. Ann is not only a board member of Dunebrook, but she is also works at the health department and has really important information for us today about car seats. And of course, the health department is just a wonderful organization that does so much. And I don't think people know how much they do. So we'll talk a little bit about that. But really, our focus today is car seats. So um, uh, I want to start out in talking about Dunebrook. Generally speaking, we do child abuse prevention and intervention. We're 33 years old. Our prevention piece, and we'll talk about that today, really is healthy families. If you're an expectant mom or you have a little one under 3 months, you'll qualify for Healthy Families, where we come into the home and teach parenting skills and help you with all the parenting questions and issues that are so many when you're first having a baby. And that program is free. So, one of the issues, of course, is child safety. And we're so happy to have Ann here to talk about this piece of child safety, which is so extremely important. But before we start with Ann, maybe Lisa, if you could tell us a little bit about, especially during the pandemic, trying to keep non-for-profits alive with, some state funding, some grant money, but also fundraising. Miss Lisa does a fabulous job. We're so lucky to have her with development, and she'll tell us a little bit about what's going on in development.
Yeah, good morning. And it's already August, and we're really excited that in less than 6 weeks, we will be hosting our first Cocktails in the Garden over at Friendship Gardens in Michigan City on September 16th, Thursday, September 16th from 5:30 to 9. And this is an event that is taking place of our dragon boat races this year, because due to the pandemic, we have not been able to, but we didn't feel that we were able to do the dragon boat races. But next year in 2022, we are going to resume the dragon boat races. But we hope you will all join us on that Thursday, September 16th. And if you would like to buy tickets or you'd like to be a sponsor for the event, you can go to our website, www.dunebrook.org, and you'll see a donate button there, Cocktails in the Garden, donate, take you to a platform to buy tickets. Or you can, it also has the sponsorship information on there as well, if you're interested in being a sponsor for the event. But we want to say that, it has been a challenging past, I guess, 18 months of this pandemic. And it has been a different way of fundraising, but we are so thankful to all the businesses and companies, friends of Dunebrook, individuals that have stepped forward to continue to support us. We couldn't do it without you. So if you want to be a part of this Cocktails in the Garden, you can also text DB Gardens to 41444, and it will also come up on your phone that way. Or be sure to check out our website if you want to just make a donation of any type, $5, $10, $100, whatever you feel. It is individuals and people in our community that help keep our programs going.
Yeah. Lisa, thank you so much. It's going to be really fun. I mean, I think this year it's casual is the key word there. It's going to be real casual, just networking, enjoying each other. We've got food trucks, cash bar, but food trucks, Social Q barbecue, and Stone Baker pizza. Oh, yum. I'm so excited.
Yeah, South Bend chocolate will be there with desserts and different things like that. So yeah, we're really looking forward to, like Jean Ann said, is nice casual picnicking time and just getting out and seeing people again and talking about our mission, and it's going to be a good time. So
yeah, thanks, Lisa, so much. So Ann, Miss Ann, again, I have to say thank you to Ann. She's so helpful and gives us such great perspective all these years that you've been on the board, Ann. And I know you're really busy, but you have always given us, with your great background and experience, I know you've guided me professionally, really. Can't even think of all the things, but as a board, you've given us great insight. So we sure appreciate all the years that you've volunteered as a Dunebrook board member, and you're still there. So thank you. But our topic of today is car seats in the health department. So maybe, Ann, if you would take a few minutes, tell us about you and what brought you to the health department and what your title is and what you do, and a little bit about the health department.
Okay, well, I started a very long time ago, actually right out of college. Um, I liked environmental protection as a major, so I kind of leaned towards that, and the health department does that in different ways. So I started off as an intern, and when a position opened up as a full-time food inspector, I jumped on it, and I did that for quite a long time, 10, 15 years.
Wow.
And then I moved over to at the time we called it bioterrorism, but now it's called all hazards. So kind of encompass um, natural hazards as well as biological hazards, and of course with the pandemic. So that's all included. I did that for 2 years, and that was just preparing the health department for an event like that, and helping the stakeholders of the county understand our role and their role in that kind of situation. So did that for a couple years. And then our administrator at the time came from St. Joe County Health Department, and they had a health educator there, and he felt that we needed one here. So since I had done several things in the department with the environmental section, septic inspector, food inspector, pool inspector, lead risk assessor, lead inspectors. So I had a very good background to do this position as health educator, and knew a lot about the health department. So I was kind of an easy fit for me to slide into. So I really liked teaching people something that I feel like they need to know, right?
Yeah.
Everybody who teaches, I'm sure, feels that way, but the information that I give people is I feel like it's important, and most of the time it's very receptive. People want to know about the diseases that vectors carry, and how to take care of their risks that are associated with owning a restaurant, and limiting their risks at a public pool, we don't have any public pools, but a semi-public pool, stuff like that. Is we're helping people to have their business lower risk. So yeah, it's been fun. It's been quite a ride.
Yeah.
Quite a ride. And now the car seat thing just kind of popped up. The State Department of Health was looking over some data and found that kids were not getting the last seat that they need in their car, which is a booster seat. Mm-hmm. And so they started a program, and they were calling it Booster Bashes. So they were offering free booster seats out to any health department that wanted to pick up the program. That's kind of what the state does. They look and see what programs are needed, and then they offer them to us. And if we have the money or the personnel, then we pick up these programs. So this one was offered for free. We didn't have to do anything. We just had to offer them to the community. So that's what I did. And in the meantime, I found out that you have to be a certified technician to do that kind of thing. And I couldn't get techs to come to my events because it's just difficult, because you're not paid. Right. It's required to do one for your certification, which is every 2 years. And I was having trouble getting certified technicians to come to my events. So I asked my boss, I'm like, well, can I become a certified technician? Since I can't get anybody to come, I'll do it. So then when I went to class, the lady that gives out the money for the rest of the car seats, not just the booster seats, she was at my class, and she was getting trained as an instructor, and she's elbowing me. She's like, hey, I got some money. Do you want some money? And I'm like, how can I turn down free money for the county? Mm-hmm. So she helped me set up at that time they called it a permanent fitting station. Now it's called a child safety seat check inspection station. It's a mouthful. Yeah, so we got it all set up and I do them once a week. It used to be on our clinic days, so I could try to interact with people coming to clinic when we don't do clinics anymore. In that office, in our Michigan City office, is now a COVID testing site. So we don't have any of our nursing services in that office currently. They're just doing the COVID testing on that half of the office. People can still come there to get birth certificates and death records. And then there's me doing car seats on Tuesdays.
Well, Ann, that is such an interesting how that all occurred, really, from all of your efforts. In fact, that you received the Child Safety Advocate Award for doing all of that work, because that just didn't happen. Had you not gone out on a limb and taken the class and met that woman and gotten, received the funding, it's a lot. So kudos to you, Ann, for doing all that. So you got that great award from the Indiana Criminal Justice Institute.
Yeah, it was an honor for sure. There's so many good techs up here that I've met in Crown Point and South Bend. So yeah, it was a really big honor to receive that award.
Well, Ann, in the big picture of the health department, and particularly car seats, I mean, I think, sometimes people wonder, what does the health department do, and money, government money, where's our money going to? But everything you mentioned in your whole career, I mean, it's wonderful that in essence, it's an insurance policy keeping us all as healthy as we can be.
Absolutely, absolutely.
Cleanliness in a restaurant or car
Mhm.
seats in a new for children. So thank you, Ann, really. And I don't think people realize all the work that goes into behind the scenes in our communities and trying
Yeah, we do a lot of things that people don't realize. And another thing people don't realize is there's a lot of things that we can't do stuff about as well.
Yeah.
But we're in the business of protecting public health. So that's what all of our programs revolve around, is protecting public health and trying to eliminate the risk for disease. So that's why we do the immunizations. That's why we do the septic inspections and checks so that there's no sewage running on the ground, and the food inspections so that people don't get foodborne illnesses. And we're fortunate enough to still have a water lab here in our department. We're only one of 2 or 3 in the state that have a laboratory left. And it's a great service because it's a lab that does not, we're not there to make money. So the expense that it costs to bring your water to get tested here is very low. So and we offer free water tests. We recommend, if you live on a well and provide your own water to yourself, we suggest getting it tested once a year, and our lab gives out free water tests once a year. So it's a great service too.
Well, and thank goodness for the health department. I mean, if our country didn't learn anything, but to have, with the whole pandemic, I mean, you certainly helped navigate that whole world of, vaccines, and oh my goodness. So thank you, Ann, really, for all you do. Can you tell us a little bit, for those wondering about car seats? Well, maybe just real briefly, Ann, about the health department. I mean, what are the services that people need to know, aside from getting our shots for our children for immunizations? What else, big picture, does the health department do for parents listening, and how they could take advantage of the services you provide?
Well, our immunizations, we have gone to those who don't have insurance. So we can only provide immunizations for people that don't have insurance. That changed several years ago. We do accept Medicaid now for that as well. And that's something new that we just started as well. The other programs that we have are the birth and death records. You can get birth certificates here. We send out notifications after you have a baby of where you can get your birth certificate and if it's here or not. We have a blood profile through our nursing services that is very inexpensive, that people come if they get a order from their doctor that they just need a basic panel for their blood. They can come here and do it. We don't accept insurance for that one either, but it's very inexpensive. I believe it's $40. And right now, like I said, we're only offering services out of our LaPorte office. So everyone's got to come to LaPorte on Mondays to do some services. We have an STI clinic that just started back up again. We are very fortunate to have Peggy Rose. She's our nurse practitioner for our sexually transmitted illness program that we do, but she has also been our vaccine queen for this whole time. And she has been she's a trooper and running our vaccine clinic, which is now located in the old LaPorte Hospital building. And you can just walk in and get a vaccine at any time.
Oh, that's great.
So she's pulling double duty by running that vaccine clinic, and then she comes here to do the STI clinic for us too, from 9 to 11 on the first and third Thursdays of the month.
So experienced and so passionate and so good at what she does. Yeah, that's great.
Yeah, we're very fortunate to have Peggy on staff. Yeah.
And that's great. So, and then finally about the car seats, just for maybe new parents, why, I mean, everyone knows you should have a car seat, but maybe you could talk about the whys of that and how do you get it? And the fact that they're for free with the health department.
Yeah, there's an accident, one accident every 14 minutes.
Wow.
And if people knew of this unintentional thing that happens to children, there would be so much more money put towards it. Because if you have a pandemic or a disease, a childhood disease that kids were getting one every 14 minutes, there would be a lot more money. But it's considered unintentional because you can change that and get the proper fit and get the proper seat and get it put in correctly in the car. And then in an accident, you have a much better chance of keeping your child from getting serious injuries. There's 3 crashes that happen when you're in a crash: the crash itself, and then the crash within the car, all of the things that are in the car. My purse would kill me, I swear, if I was in an accident, because it's very heavy and it knocked me in my head, I would definitely get a concussion. But so we teach parents that anything in the car is considered, and even the drinks, and the car seats come with cup holders, but we don't want people to have drinks in the cup holders in the seats, because they can't, if they're full, they can cause injury to a child if it hits them in the head. So we suggest not to put anything in the cup holders unless they're stopped. But yeah, so we are able to provide seats to anybody that transports children. It doesn't matter if they're foster parents, grandparents, caregivers, anybody that has a child in the car that doesn't have a seat. I want them to come see me because I want them to get a seat and I want them to be safe in the car. So we can exchange seats out. People can come to me and we can take a look at what they have to see if it still fits the child. And then if it doesn't, then we have replacement seats, and we'll teach the parents on how to install them correctly in the car.
Well, Ann, that is wonderful.
So there's 4 different types of seats. There's infant seats, which I don't carry those. Those are the bucket seats that you can use as carriers.
Yes.
They typically only go up to about 17 to 22 pounds. So you don't have them very long because kids grow so fast.
Right.
They're not very economical for me to have. I have such small amount of money. I have to use it where I can.
Sure.
So I get what's called convertible seats, and those start at 5 pounds and go up to 65 pounds.
Okay.
So that's the first seat that people receive. And since it goes up to 65 pounds, because it starts off rear facing is Stay rear facing as long as the seat allows. So the seat that I have, your child can be 40 pounds, 40 inches before you have to turn them around. So that's what I tell people. I leave them rear facing until they're 40 pounds, 40 inches. And then you can turn the seat around and it faces forward to 65 pounds.
Yeah.
And then hopefully after that, maybe they would only need a booster seat, and then they only have to have one more seat after that. It just depends on how your child grows. And that's the thing too, not every child grows in that percentile, right? So kids grow differently, and I say, what age? It's not the age, it's what size your child is. It's what type of car you have. If you have a small sedan, your kids' feet will reach the floor faster than if you have a minivan with captain chairs that, you're sitting up high. It's going to take a lot longer for those kids to reach their feet to reach the floor, because that's when they don't need a seat anymore, is when their feet reach the floor. So it depends on your car. It depends on how your child grows. And state laws are not necessarily the safest. So even though our state law says 8 years old, I have had some 8-year-olds that are still in 5-point harness just because their genes and their family are little. So if they're tiny little kids, we want them in that 5-point harness as long as possible.
Yeah.
So it just depends on how much the child is growing. It doesn't matter what age it is, but Indiana law is 8 years old or younger. They have to be in an additional child restraint in the car.
Right. Wow.
But we don't go by age. We go by approximately 4 feet 9 inches is typically when kids can get out of a booster seat. Anything under 4 feet 9 inches, they still should be in a booster seat probably, especially most people have bigger cars nowadays.
Yeah. And that is such great information. Thank you so much. I mean, there's a lot to it that I think the average person doesn't understand. I mean, it's been a long time.
Yeah, absolutely. But
in car seats. But thank you, Ann, for all that information. And I think the important thing is, if a parent has a question, to call the health department, either in LaPorte or Michigan City. But LaPorte is really where they need to go, because Michigan City is now the vaccine spot, correct?
Well, anybody can call any of our numbers and just ask for me, or my extension is 2438, because all the numbers they call goes to the switchboard, and then they get sent out to either office. But yeah, if they have any questions, feel free to give me a call. My extension is 2438, and I'm doing the car seats. They can walk in, but I would strongly suggest an appointment for Tuesday. I only do them Tuesdays in our Michigan City office.
And what's your phone number again, Ann?
It's 219-326-6808. And then my extension's 2438.
Wonderful. So 219-326-4808, and your extension is 2438.
No, I'm sorry, 219-326-6808, extension 2438.
Okay, 326-6808. Thank you, Ann. Well, thank you so much for joining.
Thanks for having me. This was fun.
And thank you for all your work on the board. It's been so helpful to us at Dunebrook. And thank you so much for all your work all these years at the health department, and particularly congratulations on your award for the Child Safety Advocate Award. That's wonderful, Ann. You deserve it. You've worked a lot of years doing a lot of different things.
great, thank you. Yeah.
Thank you very much.
Okay, so thank you everyone for listening. Have a wonderful day. We always leave by saying be kind to yourself, especially in this crazy time. I know we're getting better with the pandemic, but it's still transitioning back is a little crazy. So be kind to yourself, be kind to others, and be patient to others out in the big world. A lot of people are dealing with a lot of things these days, so sometimes a little extra love and care can help. So have a great week, and we'll see you next week.